Hello, welcome to The Healthy You. I am Dr. J, Dr. Shirley E. Jones, a board certified family physician practicing preventative care medicine that will improve your lifestyle, get you off those medications, and help you have a healthy, wealthy, and longer life. So let's get started. Understanding hair loss in Black women and the causes of CCCA and treatment options. Hair is just not a defining feature. It is deeply tied to our identity, self-esteem, and our cultural expression. For Black women, hair has always been a symbol of strength, beauty, and cultural heritage. From all our various styles and braids and locks and hairdos and updos and twists, everything that's so culturally beautiful. However, hair loss among Black women is a growing concern, affecting millions globally. Today, we'll explore the reasons why Black women lose their hair, focusing on causes and a specific condition, CCCA, and the available treatment options backed by research and data. So why do Black women lose their hair? Hair loss in Black women can result from a variety of factors, including genetics, medical conditions, styling practices, and environmental stressors. One of the leading causes of hair loss in Black women, traction alopecia. This type of hair loss occurs due to prolonged tension of the hair follicles, often caused by certain hairstyles like braids, weaves, tight ponytails, and cornrows. According to the American Academy of Dermatology, up to 33% of Black women may experience traction alopecia at some point in their lives. The continuous pulling weakens their hair follicles, leading to permanent hair loss if you don't address it early. Then there's chemical damage. Hair treatments like relaxers, dyes, and bleaching products contain harsh chemicals that can weaken the hair shaft and cause breakage. Research shows that Black women are 5 times more likely to use chemical relaxers compared to women of other ethnicities, which puts us at a higher risk for having hair thinning and damage. I'm sure you've seen the multiple commercials that are on for suits for women who've had relaxers. Another one we should address is heat damage. So excessive use of hot combs, hot tools such as flat irons, curling wands, and blow dryers. It can cause heat damage to the follicles, and it leads to a drying of the hair and brittleness of the hair, and then it breaks easily. Studies have shown that more than 60% of Black women who use these styling tools frequently experience some degree of hair thinning and breakage. And then there are other reasons, such as scalp conditions. Scalp issues like dandruff, seborrhea dermatitis, and psoriasis can contribute to hair loss if it's left untreated. These conditions cause like an itching, an inflammation in your scalp is kind of red, and that scaling, and can damage the hair follicles over time. Then there are hormone imbalances and other medical conditions due to things like polycystic ovarian disease, which you've heard of as PCO. Pregnancy, menopause can lead to hair thinning and shedding. People lose hair in pregnancy. And then there are additional autoimmune diseases like lupus, Sjogren's syndrome, rheumatoid arthritis, and then there are thyroid conditions that are known to cause hair loss. If your thyroid is overactive, you actually can lose your hair. Did you know that Black women are more likely to develop lupus 3 times than white women? So this is a significant risk factor that we need to be tested for. Then there are nutritional deficiencies. Deficiencies in vitamins and minerals such as iron, zinc, vitamin D, and biotin can trigger hair shedding. And the research shows that 40% of Black women who suffer from vitamin D deficiency also have hair thinning and slow hair growth. So get that checked when you're talking to your PCP and you're complaining of fatigue, hair loss, constipation. Have that checked. There are various causes of hair loss. And then one condition that actually disproportionate affects Black women is the CCCA. It's a type of scarring alopecia that it causes permanent hair loss. Let's talk more about the CCCA and its causes, its symptoms, and its treatment. What is it? It's a progressive form of scarring alopecia that starts at the crown of your head and spreads out in a circular pattern. It leads to inflammation, scarring, and destruction of your hair follicles, causing an irreversible hair loss if it's not treated when you first notice it. Research suggests that about 30% of Black women will experience some form of CCCA in their lifetime, making it the most common cause of alopecia in Black women. The exact cause of the CCCA is still under investigation. Experts are saying it can result from a combination of genetic, environmental, and lifestyle factors. And they've recently shown a genetic link involving a PADI3 gene that regulates hair follicle health. Let's think about it. Who are they doing the research on? Are there research studies on Black women to test this? Is it related to your food that you're eating? Is it truly genetic? There are hair care practices like the frequent use of tight styles, chemical relaxers, hairstyling tubes that can worsen the CCCA. But is that the cause? Is that what started it? Why are we having scarring that is starting at the crown of our heads and spreading out circular in Black women, causing follicle destruction and baldness? Or your scalp may be tender, it's itching, it's burning, it's red. Discoloration of the scalp, if it's white, which means it's not getting much blood supply to the scalp to nourish the follicles. Or if there's scarring, can cause you not to get blood supply. Because if you think about a scar, when you cut yourself, it forms that S scar is a thick layer of brown, and it's just hard. There's no blood supply in that. Those are old cells, necrotic cells. So the thing is, if you start noticing these symptoms in your head, in your hair, and you're losing hair, developing bald patches, early detection is critical because it does lead to irreversible hair loss if you leave it untreated. The good news is there are now several treatment options for managing hair loss, including CCCA. So let's talk about them. There are topical treatments. There is a blood pressure medicine we used to use called minoxidil. It is now marketed as Rogaine for hair growth. When we used to use this medicine for blood pressure, we noticed our patients became very hairy. The FDA approved to use minoxidil as it slows hair loss and promote regrowth. They did clinical trials, and it has shown that 40% to 60% of patients that use minoxidil experience visible hair growth after consistent use for 6 months. So let's talk about it. Minoxidil, it helps with regrowing hair. But you ask me, Dr. Jones, how long do I have to use it? Well, let's talk about it. If it stimulates regrowth after you stop it, will your hair continue to grow? The answer is no. You have to continually use the minoxidil. Another treatment for the CCCA, if you catch it early, are steroid injections. Only done at the dermatologist's office. Can prescribe these injections to reduce the inflammation, to slow the scarring and the hair loss progression. Another thing to think about this particular treatment is if you're diabetic, you're injecting steroids into your system. They're injected into your scalp. Your scalp has vasculature, which means blood supply, capillaries, arteries, veins. So if it's injected in the area, the steroids will uptake into your scalp and may increase your blood sugars. This is something to think about because remember, we exist as a whole body. Whatever you do up here is affected everywhere else. So adding steroids will increase your blood sugars. Then there are oral medications like doxycycline and hormone regulators like spironolactone that we use in severe cases. Now, as you all know, I try not to use medications for medical issues with the body because our body was wonderfully made and we have multiple systems in place to help us heal what we have. We just have to limit the amount of toxins that interfere with the processes that would help us to heal ourselves. But if you're interested, you can use doxycycline, and these should be written by your dermatologist or someone who's familiar with treating CCCA. Doxycycline is an antibiotic, but we use it as an anti-inflammatory in this inflammatory scarring condition that's causing the alopecia, the hair loss, the thinning, the destruction of your hair follicles. Some people, when they take doxycycline, they get yeast infections. So these are other side effects you have to consider when going on these medications because they are not benign. And hormone regulators like spironolactone. There are a lot of issues that go along with taking spironolactone. Do you want the side effects for the rest of your body from these medications so that your hair will grow? Or should you find other ways? But that's your choice. And then there are hair restoration procedures. Now, we will talk about these, but I will tell you, in my experience, if your CCCA has been going on for longer than 2 or 3 years, these other hair restoration procedures may or may not work. One of the major ones that's out now is the PRP, which is the platelet-rich plasma. It's only done with a dermatologist or people that specialize, but it involves getting your own blood plasma and then re-injecting it into your scalp to stimulate hair growth. They need the stem cells, which are the building cells, the beginning cells, the progenitor cells, the cells that start everything in our body. With this procedure, they draw blood, they spin it down, they prepare it, and they put it back into your scalp in micro injections. Now, studies show that this can increase your density of your hair by 30 to 40% after several sessions. So let's talk about that. It increases density and stimulates hair growth from these cells. But you need to make sure to ask your physician, are there follicles there? Because hair grows from follicles. If there are no follicles, what will be stimulated to grow? Things to think about. Then there are hair transplants. A lot of people are doing this. A lot of men participate in this. Women are starting to participate in this. You have to be deemed a suitable candidate. Like anything that needs to grow, there has to be fertile ground. If your scalp is not fertile ground, hair transplants will not take. So don't spend the thousands of dollars to get it done. Please have your scalp evaluated that the ground in your scalp is fertile. It can accept the transplant. So let's talk about what they're transplanting. They're transplanting follicles. So they actually go where you have a lot of hair. Because remember, CCCA starts at the crown and it spreads out. This is where you're thinning. They will go around here and get follicles from the thick hair, and they will get them and retransplant them into the areas. They usually don't do your whole scalp at one time. They do sections, but people go all over the world to get it done. It's cheaper in Istanbul. I've had patients to go to Mexico, Turkey, and several other places where it's one cost. It includes the transplantation, the health care after you have the procedure, the hotel, and even sometimes the flight. But I would do diligence and do my research and find people where it has been done that have the same condition that you have and see pictures, see the outcomes, talk about it. Don't just go on the price because you may come back with many issues. Having procedures done outside of the US, there's a reason the US has all of the rules and guidelines. When you go outside, the doctors perform these surgeries. What's your post-op care? Who is going to do it? Because you come back here, you may be fine when you leave the country, but when you get back, what if you begin to bleed? What if the incision opens back up? Who will take care of that? Most surgeons do not like to correct a botched job done by another surgeon, especially a surgeon out of the United States. So have discussions with your physicians that are here prior to going out of the United States and get that understanding so you will have some type of support and not suffer in silence. Let's talk about lifestyle and hair adjustments. You can do protective styling when you begin to have these thinning and balding spots and opt for like low tension styles like loose twists, braids that aren't tight, braids that are looser where you may have to change them very often, or a bun to reduce traction of the area of the hairline. Avoid heat, avoid chemicals. Do not, relax your hair if your hair is falling out. Get a natural shampoo to wash your hair. Get a natural conditioner that doesn't have all the toxins. Read the labels. More natural ingredients, the better your hair is. And minimize the use of heat styling tools and chemicals relaxers. Do not blow dry your hair. Air dry. Do like we did in the old days. Your parents washed your hair. They parted it, put it in braids, and air dried it. Scalp care. Maintain a clean and moistured scalp using natural oils like jojoba oil, castor oil, tea tree, aloe vera. And now let's talk about dietary changes. You must incorporate iron-rich foods, vitamin D, vitamin A, vitamin B, the omega-3 fatty acids to promote natural healthy hair growth. Because remember, I talked about the soil has to be fertile for anything to grow in it, to have these follicles to grow, have nutrients and good blood supply. In conclusion, hair loss in Black women is a multifactorial issue with physical, emotional, and cultural implications. While genetic and other medical conditions like CCA play a significant role, hair care practices, chemical use, lifestyle choices, and food is equally critical factors. Raise awareness, seek medical advice early when you notice your hair thinning or notice bald spots, and adopt healthy hair practices to make a significant difference. Please continue to educate yourselves. Google more about hair loss and CCA so you can combat this and preserve our cultural identity and empower other Black women to feel confident and beautiful in every stage of their hair journey.